One of the spots that I end up talking about a lot to my patients and when I'm teaching the mentorship is this spot called Erbs point. Erbs point is actually in the neck, and it's a physician's point to do injections to target like cervical pain a lot of the times. It's a very powerful spot. It's about halfway up the sternomastoid on the posterior border. And there's one cranial nerve that's there. It's the accessory nerve, cranial nerve 11. And then the rest of the nerves there are actually cervical plexus nerves. The cervical plexus are the nerves that come out of the neck. Those nerves technically are not central nervous system, but those nerves actually innervate those ligaments, that dura, the meninges, that change the pressure. Remember I said sometimes when that dura is tight, you'll feel like you have a pressure headache or a vice grip happening. That tissue, that dural tissue is innervated also from a sensory standpoint by these cervical plexus nerves. So by treating Erbs point, we can actually have this reflexive opening and decreased pressure in the cranium, which is going to help support all of our cranial nerves, not just the cranial nerve at Erbs point. So that's why we're going to start there. She'll just test her cervical range of motion. So go ahead and look at the camera, and you can rotate to the right, rotate to the left. As she goes, it warms up a little, actually more to the left. You're going to treat your Erbs point as well. So I'll step you through it. Erbs point is halfway up the sternomastoid. So the sternomastoid is the muscle that attaches to that mastoid process that we already found. And then it runs all the way down to the inside edge of your collarbone. You're going to go run along it. You can have it pop out by pushing here. Like do a little resistance test by rotating your head to the opposite way and then pushing your head forward. It pops right out. So you'll find it there. Come back. And you're just going to guess what halfway is. It doesn't have to be rocket science here. And you're going to do a skin lift technique. So you're going to lift the skin in that area, and then you're going to test the ranges of motion. So you're going to test front to back, see which way it moves easier. Missy moves front easier. Then you're going to test down and up. She moves down easier. So I'm going to go in the direction of ease, and I'm going to stack those to do the treatment. It's going to go forward and then down. And I'm going to kind of get quiet and see what it wants my hands to do. Sometimes you'll start feeling the tissue respond, and hers is, and then it makes me want to stretch it out. If you don't feel the tissue respond, it's okay. Don't worry about it. You'll just do another stretch. So we'll let go of the tissue, grab again, and then test the ranges of motion. So now she's easier up and back. So we'll do that stretch too. So we'll go up and back and wait for things to change, or just to imagine things changing and opening up in that spot, and then let go. And then she'll recheck her range of motion. And it's improved to the left, yeah? And then also check your mastoid process and see if that's changed. Better. It's still more prominent, but better?
Still more prominent, but smoother.
Cool. So that has decreased some of her tension. Do it on yourself, and you can also do it on your patients. When I do it on my patients, most of the time I have them lying on the table, but I've also done it and seated and standing. It's a real quick technique, so I've even done this on athletes sometimes in the middle of their training set. If something looks wonky, I'm like, here, let me do this treatment, and I'll just put my hands on their neck real quick and do it. You can also do it, there's anytime you're going to be stretching the skin in that area, you're going to have an effect on that. So again, it's a very general technique, so don't feel like, am I doing it right? You'll know if you're doing it right because you'll feel a change in the range of motion or a change in your mastoid process and side bending. So when I do it on myself, I'm gonna find my mastoid process, my sternomastoid, I'll make it poke out here, about halfway down or up, depending, glass full, glass empty. Gonna lift up the skin as best as I can on that area. If you're having a hard time getting the skin, you can always side bend to that side too. And then I'm testing the directions. Anterior, posterior, superior. You basically are just playing around with which direction does it go easiest. And the direction it goes easiest, you're gonna move into that space. And just hold for a second. See if you feel it start to relax a little bit under your fingers. And then let go.